Greetings, my name is Daniel Burton. This presentation is a guide to managing diabetes by Jeff Hughes and myself. We will be discussing strategies and management tools to living with diabetes and preventing diabetic complications. Here is the table of contents for this presentation. Our objectives are to define what diabetes and the different types of diabetes, examine the process of how diabetes works in the body, propose tips and strategies on how to treat and manage diabetes, outline how to prevent complications of diabetes, and discuss a doctoral prepared nurse practitioner's role in providing education to diabetic patients about preventing complications of the disease. So what is diabetes? Well, the National Institute of Health defines it as a disease that occurs when your blood glucose, also known as blood sugar, is too high. Our blood sugar is controlled by a hormone called insulin that is made by the pancreas. Blood sugar can rise as a result of foods we eat. Sometimes the pancreas doesn't work right or has trouble keeping up with our body's need for insulin. There is currently no cure for diabetes, but there are many ways to control and manage the disease. Diabetes is a prevalent issue in the United States. In 2015, it was the 7th leading cause of death. This information was based off the underlying cause of death on patient certificates. According to the Center for Disease Control, an estimated 30.3 million people in the United States had diabetes in 2015. That is 9.4% of the population, and the number continues to rise because of poor health habits in the United States. 1 in 4 adults over the age of 65 has diabetes. 90 to 95% of cases in adults with type 2 diabetes. So there are 3 main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is where the pancreas does not make any insulin. This is also known as insulin-dependent diabetes. This is a result of the immune system attacking the pancreas. Most cases are diagnosed at a young age, but it is not exclusive to children. Type 1 can develop later in life. Type 2 diabetes is where the body has trouble making insulin, so it needs help through medication, diet, and exercise. It is the most common type of diabetes and can happen at any age. It usually occurs in adulthood as a result of poor diet and exercise. Gestational diabetes is specific to pregnancy. Gestational diabetes is usually diagnosed in the 24th to 28th week of pregnancy, and with proper care, the baby health will not be affected. In most cases, it disappears after pregnancy has ended. However, it increases the risk of developing type 2 diabetes later in life. So what are some warning signs of diabetes? Usually signs include increased thirst and urination, increased appetite, fatigue, weakness, blurred or double vision, numbness and tingling in the feet, wounds that have trouble healing or do not heal, and unexplained weight loss. Not everyone experiences the same signs and symptoms, so it is important to have your blood sugar monitored closely if any of these symptoms occur. This slide is mainly a review of the causes of diabetes. There are also a few more examples of other causes like genetic mutation from live radiation exposure, hormone disease, trauma, or damage to the pancreas, and side effects of medications. There is no way to prevent type 1 diabetes, but there are certain modifiable and non-modifiable risk factors associated with the development of type 2 diabetes. Some of these risk factors include being overweight or obese, being age 45 or older, having a family history of diabetes, being of African American, Alaskan Native, American Indian, Asian American, Hispanic or Latino, Native Hawaiian, or specific islander descent, having blood pressure issues, having a low level of HDL, which is good cholesterol, or a high level of triglycerides, having a history of gestational diabetes, or gave birth to a baby weighing 9 pounds or more, not being physically active, having a history of heart disease or stroke, having depression, or having polycystic ovary syndrome, also called PCOS. This slide just covers the types of testing and diagnosing process of diabetes. Now we'll begin moving on to the types of prevention. These are primary, secondary, and tertiary prevention. This presentation will focus on tertiary prevention. However, we will briefly discuss primary and secondary prevention. Curley and Veit describe these levels. Primary refers to the process of altering susceptibility or reducing exposure to susceptible individuals and includes general health promotion and specific measures designed to prevent disease prior to a person getting the disease. An example of this is education. Secondary is the early detection or prompt treatment of the disease at the earliest possible stage. An example of this is early screening and detection. Tertiary strategies are implemented during the middle or late stages of clinical disease and refer to the measures taken to alleviate disability and to restore effective function. An example of this is management and treatment of chronic diseases. The picture on the slideshow is a way to remember the difference. P is for prevention, S is for screening, and T is for tertiary. This slide reviews tertiary prevention amongst the different types of diabetes. Type 1 is treated by scheduled and as-needed self-injections of insulin. Type 2 is treated by medications, diet, and exercise. There are also a few other methods listed in the slide, like bariatric surgery, artificial pancreas, and pancreas isolate transplantation. Because type 2 diabetes is often preventable, it is important to stay on track with your health. In order to prevent type 2 diabetes, it is essential to lose weight, eat a well-balanced diet, healthy meals, increase activity, get regular checkups with primary care provider. Even if somebody's already diagnosed with type 2 diabetes, it can be managed. The National Institute of Health recommends that you keep health on track by taking medications prescribed by the healthcare provider, reach and maintain a healthy weight, become more physically active, and control the ABC of diabetes, which we will cover later, and stop smoking. We will now begin to review the action plan, which is the main focus of this presentation. Diabetes can be managed by using the diabetes ABCs. The A1C test shows your average blood glucose level over the past 3 months. The goal is to be less than 7%. The blood pressure goal for most people with diabetes is below 140/90. With cholesterol, you have 2 kinds of cholesterol in your blood, LDL and HDL. LDL is the bad cholesterol and can build up and clog your blood vessels. Too much bad cholesterol can cause a heart attack or stroke. HDL, or good cholesterol, helps remove the bad cholesterol from your blood vessels. Blood sugar goals are usually before a meal are 80 to 130, and about 2 hours after the meal, about 180. While the ABCs are important, it's still crucial that dieting, exercise, and medications be incorporated into the action plan. It is also important to know signs and symptoms of hyper and hypoglycemia. Get enough sleep, reduce stress levels, and collaborate with an interdisciplinary healthcare team. The next few slides focus on a quick overview of diet, eating, and activity. Listed are some food groups that can be incorporated into a diet and some types of foods that should be limited with managing diabetes. Examples of good foods include broccoli, carrots, oranges, berries, oats, rice, lean meats, chicken, fish, yogurt, and cheese. Things to limit include foods that are high in saturated trans fats, high salt foods, sweets, beverages with sugar, and alcohol. Because foods can highly impact blood glucose levels, it is important to carefully plan a diet. Meal planning is a great way to limit and keep track of carbs and sugars in a diabetic diet. Carb counting is one of the most important ways to help control a diabetic diet. There are many apps that can help diabetics keep track of their carb intake. For example, Atkins Carb Counter. Weight loss planning and nutrition therapy are other vital components. Here we can see some of the benefits of being active as a diabetic. Doing things like aerobic exercises, strength training, stretching, and running can help lower blood glucose levels, lower blood pressure, improve blood flow, burn calories, improve mood, prevent falls, improve memory, and assist in getting better nights of sleep. Uncontrolled diabetes can result in a number of issues. Many are found on this chart. Examples include heart disease and stroke, both of which are related to increased risk of plaque buildup, nerve damage, which in diabetics is known as diabetic neuropathy, kidney disease, foot and skin issues. Many uncontrolled diabetics have toes and feet amputated, and eye disease like cataracts. The next two slides contain examples of diabetic action plans. The first page helps keep track of information like primary care provider, pharmacist, daily meds, including amount taken and when it was taken, health goals like taking glucose levels, weights, and lab ranges. The second page is an emergency preparation plan. It focuses on emergency contact information, glucose kits, known drug allergies, hypoglycemia warnings, and what to do in case of hypoglycemia, like when and how to self-treat or when to call 911. This form is for the patient to fill out so the healthcare provider can keep track of patients' health trends like blood glucose levels or how compliant the patient is being with their action or treatment plan. From here, the provider can determine if changes need to be made in the action plan. Diabetes is not just managed by the patient. It takes a whole team of healthcare professionals to treat and manage the disease. This includes the primary care provider, which in this case is the DNP prepared nurse practitioner, a nurse, diabetic educator, dietitian, dentist, pharmacist, podiatrist, optometrist, mental health professional, community health workers, and most important, the patient themselves. After all, no matter how many treatments are given, plans are made, or prescriptions prescribed, it is up to the patient to care for themselves. It is our role as a DNP prepared nurse to ensure that leadership competencies are carried out as we created and execute our action plans for our respective community and target populations. This action plan focuses on influencing our target population by motivating and educating diabetics on their care. Our goal is that the action plan can change how well diabetes is managed and make sure we are delivering and inspiring new and innovative ideas. In summary, diabetes is a disease that occurs when your blood glucose, also known as blood sugar, is too high. There are 3 levels of prevention to consider. The focus of these presentation is tertiary. Diabetes was the 7th leading cause of death in the United States in 2015. Types of diabetes include type 1, type 2, and gestational diabetes. Type 2 diabetes is not only treatable, but can be prevented with proper diet and physical activity. It is important to create an action plan and keep a glucose log. If diagnosed with type 2 diabetes, it is important to work with an interdisciplinary team to manage the disease and prevent further complications. Leadership competencies are a crucial role for an ARPN in developing and implementing a plan. The following slides include the reference used for this presentation. Thank you for your time.